He gently lifted the woman's legs, then he injected her with a muscle relaxant. Once the woman's muscles were completely relaxed, he let her slowly inhale the anesthesia into her body. It took less than a second. The woman had already lost her sense of awareness. The doctor supported her neck, using a dilator to pry open her mouth. Then he inserted an oxygen mask into her mouth. After confirming the woman was completely unconscious, the doctor applied adhesive tape to her eyes. Originally, this was just a very routine abortion surgery, but while performing the surgery, the doctor explained the procedure to his apprentice. Suddenly, the anesthesiologist became frantic. He noticed that the patient's blood pressure was dropping rapidly. The entire room immediately tensed up. They nervously watched the instruments in front of them. Fortunately, after a brief moment of panic, the patient's condition stabilized. Thankfully, the surgery was still completed successfully. But then, the female patient suddenly lost consciousness. No matter how the doctor called her, the woman did not wake up. The doctor immediately checked her pupils, but could not get any response. The lead surgeon quickly stepped forward to examine her, and then declared that the woman had suffered brain death. However, the woman had no previous medical history. The surgery had been completed smoothly. How could she suddenly suffer from brain death and fall into a coma without any explanation? After discussing with several specialists, they speculated that the woman might have had an allergic reaction to the anesthesia. Since there are a few cases of such reactions in hundreds of thousands of anesthesias, the hospital deemed it a rare occurrence. However, Dr. Daisy insisted on investigating further, because the female patient was her close friend, and she had recommended her friend for the surgery. Daisy began reviewing the surgery records, but there was no sign of any abnormalities. However, she did find a problematic lab report. The hospital had conducted tissue tests on her friend, but such tests were not required for an abortion procedure. This struck the husband as very odd as well. Moreover, the lab report lacked a number, and the name of the doctor who conducted the test was also missing. This could indicate someone had deliberately concealed something, but the husband naively thought it was just a hospital mistake. After all, such things had happened before. He hoped she wouldn't overthink it. The hospital had already conducted an investigation, but Daisy was convinced that something was wrong. She decided to investigate the matter further by visiting the laboratory. When she approached the on-duty doctor, he claimed that the lab report was printed out because the hospital had a special policy where the computer randomly selects patients for testing. This explanation was completely unconvincing. Daisy did not believe what the doctor said. Next, she went to the archive room to look for more records, but the computer had no record of any coding. After a sincere request, she finally got the list of all the comatose patients in the past year. When she saw the list, she was shocked. There had been so many patients who had fallen into comas.